Mild electrics, we all just covered mild electrics, I think. Oh, we had no electrics at each headquarters. Couple times, 3 times, I think. Once at the beginning, once in the middle, and once at the end, and see if that's come. Oh, yeah. Right, yeah. Yeah. They had a real party there, eh? Because our one was pretty quiet.
Yeah.
And we were the winner. We knew that. I mean, they did. We probably won it.
Yeah.
Oh yes. No, we saw football.
Yeah.
Yeah. No. Yeah.
Oh, that's a topic. That's the only thing.
I think it's a normal thing. I see Chloe asked for it.
Oh, you came through. You can see it. Yeah. No, he come in and seen us. I'm just going to drop this down, match everyone else.
That's blue steel. That's like. Yeah. That's amazing.
Well, kia ora koutou katoa. Welcome to today's briefing. I've got Dr Caroline McElnay, the Director of Public Health, with me here today to answer all the difficult questions, support me here. Unfortunately, as you can see, no sign language interpreter. I can say there will be a limited transcript of the live webcast on our the Ministry's YouTube channel, and a full transcript will be available as soon as possible after we finish. So today, there are 25 new cases of COVID-19 to report. 23 of these are imported cases at the border, and 2 are cases linked to the port worker that we reported on Sunday, and they are workplace contacts. I'll start with those workplace contacts. The first case I'm reporting today was previously considered a casual contact of the port worker when we announced that case on Sunday. This person, who is in the small firm that the initial case works for, had a very short exposure to the case on Friday morning when they became symptomatic. That's the initial case. Really, we're talking about a few minutes in the same room. This new case that we're reporting today became symptomatic yesterday and rightly was tested and has returned a positive result. They have one household contact who is now also being tested and will obviously be in self-isolation for the 14-day period. The second case, that is a workplace contact, actually came into our database after 9 a.m. However, we're making an exception and we are reporting the case today because there's obviously a lot of interest in this particular case, and it's important that people know as soon as we have the information. So this person is the previously reported workplace close contact of the initial port worker reported on Sunday, and the person has been at the jet park since Sunday. They had been tested on Friday as part of the routine workplace testing at the port and returned a negative test, and that was on top of a number of previous negative tests as part of the routine surveillance testing at the port. The person developed symptoms on yesterday and was swabbed yesterday and has now returned a positive result. His household contacts were contacts of contacts, but we had, as an extra precaution, isolated and tested them anyway. They had returned negative test results. They're now considered close contacts, so we'll complete the full 14-day self-isolation and be retested as part of that routinely, or if they develop symptoms. And obviously, further interviews are underway with both our two new cases. They are well contained and had already been spoken with, but just to see if there's any further contact tracing that needs to happen, and we will update that if there is further information. Infection via the Safrana Seville ship, which the original case worked on, continues to be the most likely hypothesis for where this infection originated. But of course, we're keeping an open mind, and that ship is currently in Brisbane. Testing has been done. We don't have any testing results to report today. If they come in, we will report them. If we get some results today, we will report those out of cycle. There are 19 crew members, and we will report those as soon as they become available. I'm moving now to the situation in the Christchurch Sedema Managed Isolation Facility, which we reported on yesterday afternoon. When we reported yesterday afternoon, we had identified and confirmed 11 cases. There are now a total of 18 cases in that facility amongst the Russian and Ukrainian fishing boat crews who all came in on a chartered flight that originated in Moscow, flew to Singapore. They remained on board in Singapore and then flew through to Christchurch and have been in that managed isolation, which is dedicated just to that group of 235. All were tested pre-departure, and in fact, 2 people didn't get on the flight out of Moscow because they returned a positive test. Our current information is that that testing was not rapid testing, it was the nasopharyngeal swabs with PCR testing. We have now got a number of the actual results from that testing, and we're going through just checking and matching with those who we now have as positive results. The initial impression is from looking at the CT, the cycle threshold values, is that some of those cases we have identified in that 18 are new acute cases, and some are probably historical infections, just looking at the CT values. But we are also doing serology testing to help us build the picture there. Those positive cases have now been moved into a dedicated quarantine wing in the same hotel in the Sedema. There were rooms set aside in case they were required. Anyone who was in a room with a case is obviously being followed up as a close contact. They are now in single rooms. Most of the people in that group are actually in twin rooms in the hotel, and we are looking at the moment at the risks of potentially moving them into single rooms, and including whether we need to use additional facilities. And we'll be talking with our infection prevention control colleagues down there and the managed isolation facilities. We are adding an additional day 6 testing for all those people, and that will happen tomorrow, because we want to be sure that there hasn't been cross-infection either on the flight or inside the facility, so we'll add that in. And we're fully expecting that this group may need to stay for additional days beyond the 14 days, just because of the nature of the number of infections and the nature of the double 2 people in 1 room arrangements there have been in there. All staff at the facility have been tested over the last 3 days, and we're going to add in some additional testing for staff members, and their families are also being offered testing should they wish to take that up. People at the airport where the travellers arrived into, which was obviously Christchurch Airport, being asked to be tested if they haven't already been tested in the last couple of days, and the bus company that transported them to the managed isolation facility from the airport is testing its drivers. We have some other imported cases to make up our total of what is possibly a record 25 cases. We haven't had that number for a while. So there are 3 unrelated imported cases who arrived from London via Singapore on the 16th of October and tested positive at the routine day 3 testing at managed isolation in Christchurch. What we are now doing, I may have mentioned this yesterday, is a sort of a little investigation on every case we find in managed isolation, particularly looking at the CT values, just to identify whether these are likely to be acute or historic cases, particularly as we've had a number of recent cases that have only been picked up at day 12. And obviously the thing we're alert for is a positive day 12 test raises the potential of some cross-infection inside the managed isolation facility. So we're wanting to rule that out by checking if these cases have a high CT value and they're asymptomatic. It's very strongly suggestive of a historical case, which again reduces the possibility there was cross-infection inside the facility. So in addition to those 3 cases that are in managed isolation in a different facility in Christchurch, there are further 2 imported cases in managed isolation facilities in Auckland. The first of these, a person who arrived on the 16th of October from Jordan via Dubai and Kuala Lumpur and tested positive at routine day 3 testing. The second person, and the final case I'm talking about today, arrived on the 17th of October from Malaysia and tested positive also at routine day 3 testing. Both those cases will now go into the Auckland quarantine facility if they're not there already. So in summary, and it's rather stating the obvious, but we have a large number of cases today. 2 are contacts, 1 close and casual contacts of the community case that we announced on Sunday. All appropriate precautions have been put in place there. The others are all in managed isolation facilities, a number of them in a single facility and associated with that charter flight for the fishing crews that were brought in. They have been captured through our procedures at the border and are well contained. And that's exactly why we have the protocols and procedures we have in place. So we find these cases and contain them at the border. So just a summary then of the overall numbers. 2 previously reported cases have now considered to be recovered, and this brings our total number of active cases now to 56. The total number of confirmed cases is 1,556. And yesterday, the labs processed 6,308 tests, and the grand total is now 1,040,911. I think that all of these cases, including the case we identified and announced over the weekend, who became symptomatic on Friday, as well as one of our contacts who became symptomatic yesterday, reinforces our critical message. If you have symptoms, do not go about your usual business. Get a test, and that is a really key part of how we will continue to have an effective COVID-19 response. Getting a test quickly allows us to then rapidly identify any contacts, isolate and test them, and that is instrumental in us being able to contain any potential onward community spread. It's also important people continue to keep a record of where they've been. Please use the NZ COVID Tracer app. I know that for those of you who do, it's always a surprise when you go back and look and think, gosh, I wouldn't have remembered I did that 13 days ago. And my final comment is just, again, putting our 25 cases today in perspective. Yesterday, Spain announced around 48,000 new cases, and that would be the equivalent of New Zealand announcing nearly 4,000 cases in one day. Spain is among a number of European countries that are experiencing well over 1,000 new infections every day and are implementing quite significant restrictions on movement and or going back into quite significant lockdowns, Ireland being a good example of the latter. So we have a significant pandemic. It's not going away anywhere soon. We have done well so far, but all that matters now is what we do now and what we do next, and we all need to play our part in that. We cannot afford to be complacent. We are not being complacent at the border and in managed isolation, and all New Zealanders need to make sure we are not being complacent in our communities here in New Zealand. We want to remain in the current state we are, which is a high level of confidence we have eliminated community transmission of COVID-19. I'm now open to questions.
Seafood New Zealand went above and beyond New Zealand government regulations and tested crew before departure. Would you like to see that added to regulations for essential workers coming out to New Zealand?
Well, I think what we've got here is a really good opportunity to look at the value that pre-departure testing adds or not. And one of the things that's quite pertinent here is, and we're going through all the results, but it seems that all these workers did have pre-departure testing. Now, often that has to happen a few days before departure, especially if it's a PCR test, to get a result before they embark. And now what we've got is clearly a number of positive results here at day 3 that were negative on pre-departure testing. So what it suggests is pre-departure testing may add some value, but it won't change anything that we do at this end. And so I think the regime we have, without 14 days in managed isolation, plus our day 3 and day 12 testing, continues to be the mainstay of how we will keep the virus out of New Zealand.
Are there tighter
reliable are
restrictions for
those
the
tests?
next lot of fishermen coming in?
Are there tighter restrictions? We will look at that. At this point in time, again, the system is working here. And whilst there may still be the expectation of pre-departure testing, it won't change anything we will do at this end, which will be following absolutely rigid infection prevention control protocols and the testing.
Sorry, jumping back to the test. Can you explain to us how reliable those tests are or their method?
Well, this is one of the challenges around pre-departure testing, is we don't have any ability to assess the validity of either the process or the swabbing or the laboratory or any rapid testing process. So it does seem that the testing, and Caroline might want to comment on this, the nature of the testing that was done actually in Moscow.
We're actively following that up, but from the information we've got, it does appear to be a standard PCR test, a nasopharyngeal swab, and the real value of the pre-departure testing is when they test positive, because obviously, and that's what happened in this situation, those individuals then were not allowed to board the plane and come to New Zealand. But for the negatives, we just do not have access to that information to say really what is the accuracy of that test in another country.
And officials there being quite forthcoming with the information that you need?
I'm not aware that there's been any issue.
Is that the CR testing you talked about, does that indicate that people got infected on the flight?
The value, the cycle threshold, the CT, it's hard to know. What it indicates is that if they returned a negative test there and it was a good test in Moscow, they got infected sometime after they were swabbed. Now that could have been before they boarded the plane. At least one person must have boarded that plane who was infectious, and there may have been transmission on board the plane. There may have been transmission once they arrived here, but the important thing is we do everything the same anyway, and the fact that we found these infections is absolutely the system working.
Well, do we know
It's been said that they've had to have a 2-week isolation as well as the pre-departure testing. Is that, or is that something that...
My understanding is that they self-isolated for 14 days. But again, I think
we don't know that.
our view would be, regardless of what self-isolation and or quarantine arrangements might have been in place before people hopped on the plane, and whatever the testing results is, we treat them exactly the same when they come here, because we've got real confidence in our systems here, both the integrity of the managed isolation and the value of the day 3 and day 12 and additional testing if needs be, as well as the daily symptom checks.
What do we know about the
given
cruise?
Given that that the incubation period is really 2 weeks, and they needed to test negative before coming here, the likelihood that someone was infectious on the plane, does that sort of indicate that maybe not everyone was self-isolating?
I couldn't pass judgment on that, but I think our assumption is, and we know that even the people with the best sort of supportive environment, it's quite hard to self-isolate really rigorously at the same degree of integrity as we know we've got in managed isolation, with that constant use of PPE, the real discipline around infection prevention control, the cleaning and so on. And that's why, one of the key reasons why in early April we moved from self-isolation at home here in New Zealand to managed isolation.
So given
What-
given all this, you're still comfortable that the next flight of fishermen should come to New Zealand?
Well, at this point, and we're liaising with both our fisheries colleagues and obviously those in charge of managed isolation. We will learn again from this particular scenario. The key thing will be the timing of that flight to make sure, because the same facility will be used. So we'll obviously need to make sure that we are confident before anyone leaves that facility that's there at the moment that they are free of the virus.
And any of these, this cohort, are any of them, needing medical care, nearing hospitalisation? Have you had communication with Christchurch Hospital over it?
I haven't had any of that information yet. So far, my understanding is that they're all able to be managed in the quarantine facility in Christchurch.
And are you still investigating active cases amongst that cohort, or have you gone through all of them now?
Amongst the cohorts,
They've all had the first round of testing, which is how we've picked up these positive tests. And then those who tested negative will have a second round of testing tomorrow, day 6, and then we'll proceed from there. There may be some further positives tomorrow, and obviously we'll report those.
Yesterday, Sealord said the Ministry of Health had not contacted them about the infections, and they learned through the media. Why is this?
I would have to look into that. In fact, one of the reasons I became aware of this was because my understanding was that Sealord had already sent some communication out. So regardless of how people found out, the system worked. We got positive test results. I've got actually a detailed timeline of when the public health folk in Christchurch notified our team, which was about 10 minutes after they had found out the results. And you would have seen that out of cycle, we actually made an announcement yesterday afternoon because of the importance of getting this information out there.
When did the fishermen go into isolation, and when do they?
Friday was when the flight arrived, and so that's effectively their day 0. But because of these infections, and we will be looking at whether actually the clock may need to be reset because we've had this quite large number of infections.
Do you generally trust the Russian authorities to give you kind of straight answers and accurate testing results and things like that?
Well, we haven't had any interaction with the Russian authorities previously, and nor have we on this. The testing and the pre-departure arrangements were organised by the fishing companies here directly with counterparts in Russia. So we haven't actually had interaction directly with the Russian authorities, so I couldn't comment on that.
But do you think in the future maybe you look at other countries to bring in fishing crews from? Is that a consideration?
Not from my perspective, because that's up to the companies. And remembering that this arrangement had been very carefully planned, put in place with our colleagues from MPI. The approval had been provided by ministers for this to happen, and there is another crew. Remembering that they're replacing crews on these New Zealand-based fishing boats, that some of them have been on board those boats for anywhere up to 6 or 12 months, an extended period because of the COVID pandemic. And that's why we have been very rigorous in the planning to make sure that we were reducing any risk to both the crews and also, of course, the New Zealand public.
But Russia's had one of the largest outbreaks in the world, and it continues to happen. Russians have been accused of fudging the numbers right through the pandemic. So is it appropriate to be seeking crews from Russia?
We've got people coming into New Zealand, mostly New Zealanders from all around the globe, including many coming from Europe and from the USA, which have in the USA the largest number of cases of any country in the world. We treat everybody the same because we know that our procedures are in place to reduce the risk to as low as possible of any infection getting into the country.
Is there a breakdown of the CT values in terms of which ones indicate that people are most likely to have a new infection versus a historical infection, and then some category where probably it's hard to tell, or do you not have that?
Carol, I'd be very good to respond to that.
We don't have that information, but our public health colleagues in Christchurch will have that information, and they'll be working through that.
I want to talk generally about the sort of the values. Then, where's the obvious, most likely acute, most likely historic, and so on.
Certainly, our observation is that from the CT value, a high CT value can certainly suggest that it's more likely to be a historic case. And when we've had those, particularly ones that have appeared in the community where for some reason the person's been tested, they've got a high CT value, we've done intensive investigations around that person, including serology, and we've been able to show, and we've reported these, we've been reporting these in the last few weeks, we've been able to demonstrate that they are a historical case. In a situation like this, the need to investigate would really be to help determine who are contacts of cases, because obviously if it's a historic case, you don't have an issue to do with infectiousness of that individual. So that's why with these particular ones, it will be a mixture of looking at who's historic versus those who are acute. And for the acute ones, that's particularly because they are actively infectious. But I want to reiterate what Ashley said earlier, is that our quarantine and isolation facilities are set up to manage infection prevention control. So we assume that anyone could be potentially infectious at any time.
And then for the casual contact who's tested positive, is there reviewing the procedures for casual?
Again, on the basis of the history from the original case, which was gleaned on Saturday night by the public health unit, they judged this person as a casual contact because the interaction was fleeting. One of the things that we'll now be looking at, and the public health unit will be looking at, is because we now have the two work colleagues who are positive. It could have been the exposure of the person, may have been a casual contact of the original case, but may have been a close contact of the other new cases, who's the person in Jet Park. So again, it's an opportunity to learn. But remember what we do with casual contacts, many of those we are testing up front, but otherwise they have very clear instructions about what to do, and especially if they become symptomatic, as happened in this case.
Many nurses,
The scan numbers for as a COVID tracer have been trailing off for a while now. What is the Ministry of Health doing to get that usage back up?
Well, two things. First of all, I'll be encouraging people every day, and we'll be pushing out the message for people to keep using it. What we have seen is that when there's an imperative to use it, clearly Kiwis are quite happy to use it. But I think the other important point here is we are still developing the app, and we are still actively looking at Bluetooth functionality for it. And I guess when we're in a sort of a more, if we were in a higher alert level, and we've seen that in Auckland around the country, people not only took up the app, but they were using it at high levels. When we're in alert level 1, as we are now, that Bluetooth functionality will be of additional value because it doesn't require people to actively take their phone off and out and do the QR scanning. So we're still looking at, that will be one of the functionalities we're intending to add to the app. And I think again, its value will be of particular importance during alert level.
Do you know what conditions were specifically put on this crew to come over? And do you know whether they were followed?
What sort of conditions?
Like whether MPI put any or Ministry of Health put any conditions specifically for this crew to come over?
Well, I don't have the details, but as I said before, there was some very rigorous planning around this, including the requirement for the self-isolation before they departed, the pre-departure testing. It was a dedicated charter flight for both legs. They're in a dedicated facility. There's additional security being provided at the facility. So there were some bespoke arrangements for this crew, and that was all arranged with the companies and with our colleagues in fisheries.
And I guess on that, there will be a lot of industries that will want to bring maybe cohorts of this size in the future. Is there anything that you're already learning from this experience that you think you'll have to tweak for next time with the planning?
Well, most certainly, and obviously in particular for the next group of these fishermen that's due to arrive within a couple of weeks' time as well. There will be plenty we will have learnt. And this isn't the first group of sort of essential workers that has come in. I think we've had vets, we've had some agricultural workers that have come in, but this is obviously the biggest group. And again, one of the challenges here is they've come from, many of them are not English speakers, and so they've come from the Ukraine and Russia, and obviously we've got interpreters involved as well, but all these things will help us learn.
But is there anything specific that you already will change for the future?
I guess we're sort of less than 24 hours into this one, but what it can, so I mean, what we are already changing for this cohort is adding in the day 6 testing. So that's a new thing because of what's happened here.
I mean, you talk about the, do you know the delay between the testing and the departure from Russia?
I don't have that information,
And-
but if we find that out, we'll make that public.
And in terms of the day 6 testing, is that because, are they still being confined to the rooms?
No, they're not being confined to rooms. Their rooms, and in fact, they've been allowed out for breaks, including cigarette breaks.
So the day 6 testing, is it because of that? Or are you concerned that there might be a large number of active people kind of moving around the facility?
Yeah, two reasons. One is, of course, that there's the twin rooming, which is unusual. Usually people are either in family bubbles inside a room or they're in individual rooms. But secondly, just to make sure that there hasn't been any cross-contamination in those first few days, because we have found that quite large number of positive results.
Do you know if there has been any vaccine?
Well, I don't know exactly, but what I can say is we talked about this with colleagues this morning. I mean, there's been high levels of compliance. There's been obviously, the usual oversight, security, and support for infection prevention and control.
And those measures that you mentioned before with the charter flight and having a single facility, were they requirements that New Zealand put on, or were they requirements that fishing companies? So
I think those were, what I would say is those were arrangements that were agreed between New Zealand officials and the fishing companies to help facilitate getting this workforce over here in a way that was safe for New Zealanders, and that's obviously a key priority, the paramount priority.
Are there other international fishing crew in other facilities around New Zealand?
Not that I know of.
When you look at the bigger picture here, though, there was supposed to be 2 weeks of self-isolation, then there was supposed to be testing before they left. As you said, lots of rigorous kind of stuff put in place. And within 4 days of arrival, 5 days of arrival, you've got more than 8% of the cohort who's tested positive. Does that kind of strain the credibility that these things may have actually happened?
I think what it does is reinforce the importance of the protocols we've got here, because, just also by way of example, a number of the flights that come to New Zealand, particularly from the Middle East, have pre-departure testing as well, usually rapid testing at the airport, but we still get positive. So anyone who tests positive isn't allowed to board the flight, but we still get positive results here on day 3 testing. So I think what it does show is that pre-departure testing is, again, it's not, it may add value in some circumstances. It's anyone who tests positive cannot then board the flight, but it doesn't change what we do in New Zealand with our managed isolation.
On the port worker and the contacts and so on, are there any, and forgive me if you've already answered this, but are there any ongoing investigations into like contacts and contacts? Are there other workplaces that need to be scrutinised? How far could the virus have spread through that avenue?
Well, Auckland Regional Public Health are very actively following up further investigations from the 2 cases reported today. The focus to date has been around the ports and the ships. That the original case that was reported over the weekend, the ships that case had been on. So they are actively following those up with testing. So we are taking a very proactive approach to contacts, and we've certainly reiterated that message to Auckland Regional Public Health.
It's got to the point now, right, where you've got, and forgive me if I've misremembered, but family members of port workers, right? Presumably they operate outside the port environment, in the community. Is there concern around that?
There's not, and I'll tell you why. Just to reiterate, this is a very small company for employees. It's not actually based at the port, and so the only interaction that those workers, even though they're described as sort of port workers, actually they're not based at the port. They work on the ships, and the only interaction they really have at the port is with the security guards as they go through and straight to the ships. Hence the focus on the workplace contacts, small workplace, 4 people, and the ships and others who might have worked on the ship, particularly the one that's now in Brisbane. So the pilot and any stevedores that were involved in the work on that ship when it was in New Zealand have also been stood down and tested.
Many nurses that New South has spoken to have left their jobs at managed isolation sites after the DHB took over. They say current shortages are dangerous for staff and returnees. Internal documents confirm there is a shortage. Do you have any concerns about this?
I don't, and I don't share the same view. And in fact, if I give an example, across the managed isolation facilities in Auckland, there are 175 nurses that work and healthcare assistants that work across there. At the moment, 100 and, well, actually, as of last week, 120 of those were employed by the DHBs. And presumably they had taken up that role because they were comfortable to work there. There was still arrangement in place to use 55 agency staff. That's Geneva, which is the company that has been involved right from the start in Auckland. And so the DHB is recruiting to move to a fully DHB employed workforce. And they are great people who are doing excellent work to help keep New Zealand safe.
We've been told that the claim that current nurse numbers are safe and sufficient is simply not true. Nurses are burnt out. What evidence do you have to suggest all is going well?
Well, I have great confidence in my colleague Fupurio Imagiapa, who's the Chief Executive at Counties Manukau District Health Board, and her team, who are overseeing the employment, the clinical supervision and the clinical support of the nursing and other healthcare staff that work at the quarantine facility and managed isolation. So what I do know is that if there are any issues, they would be both open to hearing those and acting promptly on any of those issues.
Do you have an update on the crew of the Ken Ring in Hawke's Bay?
That ship is still offshore. At the moment, we're still considering them as close contacts, and Caroline's got the latest information there.
Yes, so because our port worker was on that ship during his infectious period, the people on that ship, we don't consider them to be the source of his infection, but we do consider that they have been close contacts, and so they are receiving daily symptom checks. And so that's underway. That's been happening since we were aware of it. And I think the ship is still off the coast at Napier, and we're just awaiting updates from the shipping company around where the ship will be moving to next.
Is anyone sick, or are they tested?
No, they're all symptom free.
I think the other comment just to make on that is even if they are not tested in that 14-day period, if they subsequently want to come ashore, they will need, anyone who comes ashore will require the whole crew to have be tested negative.
With that fishing crew, how confident are you that you've got it contained now? Are you expecting a lot more cases to pop up?
Well, it's contained in the sense that they're all in the managed isolation facility. I would be surprised if we don't find more cases either at the testing tomorrow or at day 12. Whether those are acute or historical will be the important thing. And we will. That's why we are testing at day 6 as an additional measure. And of course, then once we've got any results from that, if that requires further testing and or extension of the managed isolation period, that will inform our decisions.
Is there a chance that it's already kind of ripped through the whole crew, that it's sort of reached that tipping point?
No, I don't think so, because remember that once they've arrived in the facility, even though they might be sharing rooms, there are very strict protocols in there, and those are carefully supervised, and all the reports we have is that there's a high level of compliance there, and that's exactly why we have those arrangements in place.
We've been told that there is no dedicated swabbing teams anymore. On-duty nurses are expected to do health checks and swabbing. Is this a problem?
No, I don't think it's a problem.
Last week, or maybe the week before, there was a group of academics that released this statement against lockdowns, the Great Barrington Statement.
Yes.
Something you've heard of, and do you have any thoughts on that?
Yes, I have heard about the statement, and at the same time, I think you've seen a number of very credible and prominent public health leaders from around the globe take a very compelling, I think, and opposing view. And again, I think the extent to which New Zealand has been successful in using lockdowns at the right time and for the shortest period possible, which a number of countries have done successfully, including Australia, and there are many others, I think is a testament to the fact that lockdowns can and should play a place where necessary as part of a response. But just to reiterate the WHO view on this, which is exactly that, but it's not the first tool you should reach for in the bag. And in New Zealand, as we've learned more and strengthened our broader approach around testing, contact tracing, managed isolation, the less that part of the reason for that is so that we don't need to use lockdowns in the future. And I think that our management of the last 2 or 3 community-based cases is showing that that is possible, and other countries have shown us too. Did you want to comment? Okay.
The
On the
full work-
She
Australian-
agrees.
On a soprano ship that is being stopped from being docked in Australia until we know more, you said it was still likely the source of our infection. Do we have any timeframes of when we'll know more about whether they'll be confirmed and what kind of chats are you having with Australia?
Yeah, very intense discussions with Australia. So it is actually in Brisbane. It got there 2 evenings ago. The crew, all 19, have been tested. We're just awaiting the results. They're a couple of hours behind us time-wise, but I think people will recognise Queensland's one of the states that's got very strict internal border arrangements and restrictions, and so they're obviously very keen to ensure that no one in that crew is likely to be infectious, and if they have positive results, they will do whole genome sequencing so we can see if we can get a match with the cases we've got here.
And is it today or tomorrow that we'll know the results of those?
Well, I would expect today, and once we find out, we will make that information available.
Still on the portal again, and there's 2 further cases, but there's no need, it feels, to change the level of restrictions. You outlined previously why it seems to be contained still. What would happen for you to feel the need to recommend a move to level 2?
Well, I think a move to level 2 would have been something that we might have advised when we first found the case if we were not clear where it had come from, or if we had found some other cases popping up that we weren't aware of. But in this case, we've got a really a strong line of inquiry as to where this person may have become infected, and we have been able to identify, very rapidly the close contacts and isolate those people. So I think that's the system working as it should in the community. Final couple of questions.
So if if the tests all come back negative and we don't see any link to that, does that then
Yes,
change
that's
it?
something we discussed earlier on. I mean, we will cross that bridge, but it seems both in terms of timing and the nature of the subtype of the virus, which is not one we've had in New Zealand before. It's not a common one from Australia, the UK or the USA. It seems that is almost certainly the most likely source of the infection. Did you have some comments?
Only just to add to that every case has a full case investigation, and it may be that one of the case that's been reported today that had a common exposure to the case that was reported over the weekend, and hence our focus on the ship. It may be that there's something else in that individual's history that gives us a strong line of inquiry. Those are the sorts of questions that Regional Public Health will be going through thoroughly today, just in case it looks like the Strafrana is not actually the source of infection.
Is it shining more light for you on the Americod cases that that this is a possible source of infection through ships?
It hasn't necessarily shone any more light, and I should say that we still haven't found the source of that original Auckland August outbreak. But what it does suggest is that what it does confirm is that the virus can come in through anywhere in the border at any point in time, and that's why we've continually strengthened our arrangements, including the very now well-established surveillance testing of workers at seaports and at airports. Thank you very much. Appreciate your time.